everyone. Oftentimes in the clinic, I get the question, hey, Dr. Dugan, my back hurts after I sit for a while. Why is that? And what can I do to prevent it or make it better? Well, when we're sitting for a long time, the muscles on the front of our body tend to get really tight. So we have the iliopsoas. It attaches at T12 and it comes down to L4. So that's your thoracic spine and your lumbar spine. So let's pretend that this is my muscle. It attaches up here and comes down into your pelvic cavity, and that makes your iliopsoas. It's two different muscle groups together, your psoas and your iliacus. Those muscles come through the pelvic area and attach to the front of your hip and your hip flexor, which then come down through your quad and attach to the top of your knee, which come down to the bottom of your knee. So it makes this really long chain across the front. Now you can see in my funny little description here that it's pretty straight if I'm standing up tall, but when I sit, it gets all bunched up. So it's in a shortened position right here, and it doesn't need all that slack. So what it does is it takes up that slack so it can lay flat. It gets really short when we sit here for a long time. Then we want to stand back up, but I've lost that length in this muscle, so I no longer can stand up without pulling on this muscle. Or what we can do is compensate through our low back. This muscle is short here, so it's pulling me forward. To offset that, I can tilt myself backward. Then you're going to get that pinch across your back. Because of that high attachment that I mentioned to you, it's going to pull your spine and your pelvis forward. It can cause compression along the backside. Now there's a couple ways to offset that. We can kind of stretch while we're sitting. If you're in a desk job, you're probably going to notice this. You don't even have to stand up to get that same symptom response. Because these muscles have tightened down and pulled you so far forward, it's already compressing along the backside and you're getting that aching back. Throughout the day as you're sitting, preferably every 30 minutes or so, I want you to try to stretch these muscles. Easy way to do it, scoot to the edge of your chair here. Drop that knee down behind you. I want it behind your hip if possible. Now if you're not that flexible, you may start up here and that's okay. That's just where we're starting. So get it behind you. I want you to press your glutes forward using your muscles, not your hands like I showed you. And you're going to feel a stretch maybe in the abdomen area, maybe in the front of the hip, maybe in the thigh. Just try to hold it 15-30 seconds and do that a couple of times throughout the day. That'll help to get this part to loosen up so you're not so tight. Now if you can stand up, I do want you standing every 30 minutes or so. Once you stand, an easy stretch is to swing your leg around behind you on the chair that you are sitting in. And same thing, we're going to push that hip forward. Now we're going to get a nice tall stretch. So this is helping us get into the standing position without having to rely on this tilting to get the motion. Now from the side, it looks very similar. You're going to put the leg behind you on the chair and then push that hip forward. Now if you don't feel like you're getting a stretch, you can squat down on the other leg and that's going to intensify the stretch in the quad. I do want you to try to get in the front of the hip if at all possible, however. Now if you've already gotten the pain, you can try those stretches, but they might make you hurt a little bit too much. You can loosen it up a little bit with a piriformis stretch. Just cross your leg over and pull to the other side and you'll start to feel some stretching through here. This isn't fixing the problem in the front, but it'll help relieve some of the discomfort you have in the back. So pulling across will get a good stretch right in here, and right here if you lean to the other side. Kind of gets two different muscle groups doing it that way. So you can pull your knee over or you can come over and lean this way. It's really whichever one feels better for you. And then you can also try a hamstring stretch, putting your leg out in front of you, keeping that chest up and leaning forward. So those 4 stretches are what I recommend people to do intermittently throughout the day. Some of them are going to be more beneficial before you have the pain, and some of them more beneficial after you have the pain. So a quick review to help keep you from getting pain. Go ahead and every 30 minutes, put that leg behind you in your chair, push that hip forward gently, just get a stretch. Now if this causes any increased pain, back off of it, or just stop that exercise and talk to me about it in the clinic. You can put the leg behind you and then push that hip forward. That is more aggressive than the first one. Be aware of that. If you have more discomfort, please back off of it. Then you have your piriformis stretches. The side you're trying to target is going to be the one that you cross. You're going to pull that knee over. You're going to feel it out here. Or you can get some of your low back muscles, your quadratus lumborum, and this at the same time by just having it rest across your leg and leaning to the opposite knee. you do see some trunk rotation with this to get the low back in there. And lastly is your hamstring stretch. The leg is out in front of you. Keep your chest up so that we make sure the stretch is coming through the hip and not the back. And just lean forward. Now hopefully that'll help with any pain you're getting at work if you do this gently, not going into pain, and frequently throughout the day. If not, just give me a call and we'll look and see what else we can do for you. Thanks.